Okay, we have already seen our biochemistry. We have already seen few topics from HAP. We have almost completed our 60 to 70% pharmacology. So what is remaining? Your microbiology is remaining, and then antibacterial drugs. Okay? And in between there are also some autocoids and all that. Autocoids and hormonal drugs are remaining. Otherwise, pharmacology is completed. So whatever we have seen, same we have seen from medicinal chemistry point of view also. Chemistry part is also completed almost. After this, there will be two sessions on the dispensing pharmacy today and tomorrow. Then after that, we will start our physical pharmacy. So physical pharmacy will take around 10 to 12 sessions. Okay, after that, industrial pharmacy will start. So in between physical pharmacy and that, where we'll also try to cover jurisprudence, some topics of jurisprudence, and your microbiology. So today we will see dispensing pharmacy for your GPAT Niper and other exams. Everything is not important from this dispensing pharmacy, but whatever is important, I would like to explain you in a short. So they will ask you around one or maximum two questions from this dispensing part. You can expect two questions from dispensing part. Very important, parts of prescription. Parts of prescription. What is a prescription? Prescription is nothing but the written order. Is nothing but the written order of physician. Written order of physician to the pharmacist. Written order of physician to the pharmacist, indicating the name of patient, age, and other factors, and also instructing the patient how to take the medicine to dispense a particular type of medicine, particular dosage form. That is a written order to a pharmacist known as a prescription. They used to ask question on this part of prescription, parts of prescription. So what are the different parts of prescription? So एक prescription है आप अगर देखे होंगे आप if you have work on a dispensary or if you have work on medical shop, so you might have seen the prescription. The prescription will have different information. So prescription will have for example, name of dispenser, name of prescriber. So name of hospital, name of physician, and it along with its qualification. So that is the one part. Okay. After that, what are the next part? So next part is nothing but the prescription will have patient name, right? Date, then age of patient, sex of patient, weight of patient, etc. etc. So basically patient information will be there. So first the name of hospital and physician and his qualifications. After that patient information is there. So patient, that is name of patient, age, sex, weight, date, and time. Okay, time is not required, but date is there. Now after that there is one part known as a superscription. So first part, there is a patient information, patient information. Second part is nothing but the superscription. Now what do you mean by superscription? So what is contained in this part? So it is one of the part of prescription. Prescription का एक part होता है इसमें, मतलब ऐसा separately part नहीं होता है, prescription में ही होता है. After the patient information there is a superscription. Now what is superscription? In that you are going to have this symbol RX. In the superscription you are going to have this symbol RX. So you will find this RX symbol already printed in the prescription. Nowadays it is a printed prescription, but before the modern era of medicine there was a dispensing practices. So doctor used to prescribe medicines, and then pharmacist uh, has to formulate it in a dispensary. So dispensing practice was there. So pharmacist has to formulate and then he has to dispense medicine. But nowadays ready-made formulations are available. The doctor just used to prescribe the name of tablets, that's it, name of brand name, and you have ready-made tablets, you have ready-made formulations. But at the okay, at this before the modern era, there was a dispensing, there was a formulation and dispensing. So that's why sometimes pharmacist at that time it was known, he was known as a dispenser, or he was known as a compounder, because he has to perform both compounding as well as dispensing, both functions. At that time ready-made formulations was not there, So nowadays it is a ready-made formulations are available. You just have to pick up that formulation and you have to dispense it. Okay, that's it. Now what is superscription? So in the superscription you will have a symbol RX. What do you mean by RX? You might have seen a few students, they used to describe their name DRX. So what is RX that? सुपरस्क्रिप्शन में जो RX होता है वो क्या है? So it is a Latin word. RX is coming from Latin word. Now what is that? RX means recipe. RX means what? Recipe. RX means recipe. It is nothing but the meaning of this RX is a recipe, or it means you take. What you take? What do you take? Following things you have to take. So you take. RX means what you take. आपको लेना है, क्या लेना है भाई? नीचे जो मेडिसिन का नाम दिया है, जो भी प्रेस्क्रिप्शन में लिखा है, वो लेना है आपको. तो बेसिक, okay, in the superscription RX symbol is there. What is the meaning of that symbol? You take. You take. The symbol is nothing but it is a symbol of recipe, or it is nothing but the you take. That means RX symbol means you take, or patient should take. So what patient should take? Medicines. What medicine? That will be described in the upcoming part in the prescription. So symbol RX means it is a word for recipe, Latin term for recipe, means you take. Now it is believed that this symbol came from the god of healing. God of healing. God of healing से ये symbol आया है, ऐसा मानना है. It is believed that it is a symbol of god of healing known as a Jupiter. Jupiter is nothing but the god of healing. Now, there was a question in GPAT 2021. The symbol RX, the symbol RX is present in the following part of prescription. Simple question was there. The symbol RX is present in the following part of prescription. And they used to give the option like superscription, inscription, subscription, transcription. So you used to get confused. यहाँ पे वो ऐसे ऑप्शन नहीं है आपको कंफ्यूज करने के लिए. तो सुपरस्क्रिप्शन में क्या होता है भाई? RX symbol. RX symbol क्या है? It is a word Latin word known as a recipe, and it means you take. What do you take? Following medicines. So it was believed that this symbol was derived from the god of healing known as Jupiter. Is that clear? Am I audible to you? Now after that, inscription. Okay, superscription, then inscription. So in the inscription, whatever actual medicines a patient wants to prescribe, so he is to prescribe in this section. So after, है ना, आपने देखा होगा एक प्रेस्क्रिप्शन है, उसके ऊपर ऊपर क्या है कि हॉस्पिटल का नाम है, डॉक्टर का नाम है, एक्सेट्रा एक्सेट्रा. उसके बाद में क्या RX सिंबल रहता है, उसके नीचे क्या रहता है, फिर मेडिसिन के नाम रहते हैं. सो RX सिंबल का जो पार्ट है उसको अपन बोलेंगे सुपरस्क्रिप्शन, जिसमें मेडिसिन है उसको क्या बोलेंगे? इंस्क्रिप्शन. ओके, सो एक्चुअल नेम्स ऑफ मेडिसिन दे आर प्रेस्क्राइब्ड इन द inscription. They might ask you a question like this, कि the name of medicines or the treatment is considered in the following section of your prescription. So option में वही आएगा, superscription, inscription, subscription. So remember RX symbol is in a superscription. Inscription में होता है आपका actual name of medicine. They are okay, actual name of medicine to be prescribed. They are present in the inscription. After that, subscription. After that, next part is a subscription. So in this part there is instruction to the pharmacist. Instruction to the pharmacist in the sense जो old era था उसमें सबको कंपाउंड करके डिस्पेंस करके डोसेज बना के देना पड़ता था. तो उसके लिए इंस्ट्रक्शन था फार्मासिस्ट के लिए कि ऐसे ऐसे बनाओ, है ना, इतना इतना ये बनाओ, इतना इतना वेही इतना. बट नाउ इट इज इन द सब्सक्रिप्शन इंस्ट्रक्शन टू द पेशेंट मीन्स so how to take the medicine. Okay, once a day, twice a day, thrice a day. So that is nowadays it is. Okay? So in the superscription you have RX symbol, in the subscription you have instruction to the pharmacist. In the superscription RX symbol, in the inscription you have actual name of medicine. In the subscription instruction to a pharmacist. Now next part is nothing but the transcription. What is transcription? So it is again instruction to the patient about the medicine. Instruction to the patient about the medicine. Last part is there known as a signature or signature. Signature or signatura. That is a Latin term. Signatura. So it is nothing but the signature of okay, signature of physician. A prescription should be signed by physician. So this is the main part. Superscription, inscription, subscription, transcription and signature. Other patient information तो होना ही होना है, वो तो आता ही. To that, renewal instruction, that prescription has to be renewed or not. Sign, okay, sign and register number of your prescriber. It is also there. These are the parts of prescription. Parts of prescription. Simple. Okay. Superscription, in that you are going to have RX symbol. Inscription, that is nothing but the actual name of medicine. Subscription, instruction to the pharmacist. Transcription, instruction to the patient, and then signature. So that is the main part. Parts of prescription is again important. They might ask you question this. Okay, or they might have a question like this. So a drug, if a narcotic drug or if any, okay, if any sedative hypnotic drug is there, so that prescription should be in a duplicate. So जो भी हैबिट फॉर्मिंग ड्रग्स अगर होते हैं, नार्कोटिक ड्रग अगर होते हैं, उसका अगर प्रिस्क्रिप्शन है, सो दैट प्रिस्क्रिप्शन शुड बी डुप्लीकेट. दो प्रिस्क्रिप्शन होना चाहिए. so, एक पेशेंट के पास में और एक फार्मासिस्ट के पास में. तो पेशेंट बाद में उसको ही लेके आएगा, दे दो मेडिसिन. पार्ट्स ऑफ प्रिस्क्रिप्शन. देन विल सी नेक्स्ट is nothing but the incompatibilities. Next is nothing but the incompatibilities. So incompatibilities, nowadays it is not there, incompatibilities are not there, but when there was a actual dispensing and compounding practices, at that time lot of incompatibilities used to happen because of the mixing, because of the various reasons. Now classification of incompatibilities. इनकम्पेटेबिलिटी मतलब क्या होता है? इनकम्पेटेबिलिटी मतलब अगर दो सब्सटेंसेस आप मिक्स कर रहे हो, सो इफ दे आर इनकम्पेटेबल मतलब क्या है? वो मिक्स करते करते उनका लिक्विड बन जाए, है ना. इफ यू ट्राई टू मिक्स फिनॉल एंड थाइमोल, इफ यू ट्राई टू मिक्स, है ना, थाइमोल एंड कैम्पर, सो what will happen? Phenol, camphor or phenol or thymol, though they are solid in nature, when you used to mix it by using mortar and pestle, so their boiling point decreases, and that's why they used to get liquefied. So those type of mixtures, they are known as eutectic mixtures. So it is one of the incompatibility. If two or any of the drug or additives, if they are incompatible, that results in either insolubility, liquefaction in the precipitation, or they might be alter the therapeutic value of that prescription. That's why incompatibility. So types of incompatibility, कितने type के होते हैं? So basically there are three type of incompatibility. First one is nothing but the physical incompatibility. So what do you mean by physical incompatibility? Physical incompatibility मतलब क्या? Okay, you will have certain physical change. So if two or more components of the prescription, if they are incompatible with each other, you will find a certain physical change. So what kind of physical change? If they are incompatible, there might result in the insolubility. है ना. अगर solution है आपके पास, एक सिरप है, उसमें अगर कुछ citric acid डाल दिया, suppose you have syrup of alkaloids, and if you add acid in that, citric acid, what will happen? So that alkaloids will get precipitated, right? So result in the insolubility. So insolubility. Then liquefaction का example मैंने already बोला है आपको. So if you try to mix phenol, menthol, thymol, that result in the liquefaction, precipitation. Then immiscibility. So all these are the examples of physical incompatibility. Now likewise that there are certain chemical incompatibility. What are the chemical incompatibility? Due to their some type of chemical reaction is involved. There are two types of chemical incompatibility. First one is the adjusted type, and second one is a tolerated type. So adjusted means what? If there is some kind of chemical incompatibility, so you have to adjust, you have to add third substance to recover that incompatibility. That is known as adjusted. Tolerated मतलब क्या? कि आपको दिख रहा है कि there is incompatibility, but that will not affect therapeutic value. So it is okay. I told. So examples of chemical incompatibility. So color change, then effervescence, then precipitation, then decomposition. These are the types of chemical incompatibility. Now what are the therapeutic incompatibility? Therapeutic matlab that is related with the action of drug. Therapeutic incompatibility matlab if two drugs are given together, if they alter the either kinetics of each other or dynamics of each other, or they may exert more effect, that is synergism, or they may antagonize each other. So these are nothing but the therapeutic incompatibility. So basically they will affect the therapeutic value of, so if two or more components given together, if they affect the therapeutic value, that is not therapeutic input. So example उसकी क्या रहेगी? So kinetic interaction, for example in the kinetic you have absorption interaction, then distribution interaction, metabolism interaction, and elimination interaction. Okay? So likewise, for example, agar if you take antacids along with the tetracycline capsule, what will happen? So antacids will form a chelates with the, because in the antacid you have aluminum ions, you have calcium ions, you have magnesium, potassium, etc. So all these metals will form a chelate with the uh, tetracycline. It will not be absorbed. That is a kinetic interaction. Again distribution interaction, let's say drug distribution interaction, drug distribution interaction, है ना? एक ज्यादा एक ज्यादा बाइंड करता है प्रोटीन को, दूसरा कम करता है, लेकिन दोनों में इंटरेक्शन लाइक दैट. मेटाबॉलिज्म, एंजाइम इंडस और एंजाइम इनहिबिटर्स, है ना, लाइक दैट. देन elimination interaction, some drug will increase the elimination, some drug will prevent the elimination. So elimination. Now dynamic interaction means potentiation is there, you know, synergism is there, or antagonism is there. Potentiation, synergism, antagonism, or wrong dose is also there. So these are the types of therapeutic incompatibility. So in the you may physical incompatibility may result in, you know, physical incompatibility may result in if two or more ingredient of the formulation, if they are incompatible physically, that may result in the either insolubility or liquefaction or precipitation or immiscibility. If two or more ingredient of the prescription or formulation is incompatible, it may result in the color change, it may result in the effervescence, it may result in the precipitation, it may result in the decomposition. If two or more ingredient present in the formulation or prescription, if they are incompatible, that may result in the drug kinetic interaction, drug dynamic interaction. Okay, so this is the incompatibility. We'll see with the examples. What is incompatibility? Incompatibility is nothing but the physical or chemical or therapeutic reaction of drugs with other medicaments or ingredients when they are used in the formulation. Now this kind of interaction, physical, chemical or therapeutic reaction of a drug with the another drug, or drug with the excipient, okay, drug with another drug, or drug with the excipient, or drug with the ingredient, that renders the formulation inappropriate to use, है ना. अगर ऐसा कुछ इंटरेक्शन होता है, फिजिकल इंटरेक्शन, केमिकल इंटरेक्शन, थेरेपेटिक इंटरेक्शन, और चेंज होता है, if there is a change in the formulation, okay, and if that change is rendering the formulation inappropriate to use, अगर वो formulation के अंदर, अगर आपने, से मैंने बोला है कि अगर आपने, है ना, अगर आपने कोई सिरप है आपके पास, अल्कोहल इपेटिन हाइड्रोक्लोराइड suppose, if you add sodium bicarbonate or soda, if you are carbonated beverage to that, what will happen? That epetin hydrochloride will be precipitated, and now it is inappropriate for use. So that's why incompatibility is nothing but the physical or chemical or therapeutic reaction of a drug with the another drug or medicament or ingredient used in the formulation. That reaction renders the formulation inappropriate to use. That is nothing but the incompatibility. Now we have seen the types of incompatibility. Now, physical incompatibility that can be caused by either immiscibility or insolubility or liquefaction, or first one is insolubility. First one is insolubility. So examples of physical incompatibility in that also insolubility. For example, एक पहले तो sulfur powder, corticosteroids, antibiotics, they are not soluble in the solvent, है ना. अगर आपने सल्फर पाउडर ले लिया या फिर कोई कॉर्टिकोस्टेरॉइड ड्रग है जैसे डेक्सामेथासोन, बीटामेथासोन, ट्राइमसिनोलोन, है ना आपका बाद में प्रेडनिसोलोन, ये जो ड्रग्स होते हैं दे आर नॉट सोल्यूबल इन द सॉल्वेंट जैसे वाटर. So you need a wetting agent over there. So you need a wetting agent. Insolubility, one of the physical incompatibility, right? Insolubility. Excess of flocculating agent may result in the claying. So if you are preparing a suspension, अगर suspension है उसमें ज़्यादा flocculating agent डाल दिया आपने, तो ज़्यादा flocculating agent, excess of flocculating agent will cause डेवलपमेंट ऑफ क्ले एट द बॉटम ऑफ सस्पेंशन. तो सस्पेंशन में अगर आपने बहुत सारा फ्लोकुलेटिंग एजेंट डाला तो उसमें क्या बनता है कि क्ले बनता है. क्ले मतलब इट विल गेट अ सेडिमेंट एट द बॉटम. सो कंट्रोल ऑफ concentration ऑफ वेटिंग एजेंट इज आल्सो important. Due to change in the solvent, like in case of tinctures, precipitation may occur due to change in the solvent, like in case of tinctures. The tinctures है tincture of alkana और जो भी tincture of benzoin है ना, तो वो एक पर्टिकुलर tincture of benzoin वो एक soluble है हाइड्रोअल्कोलिक solvent में. अगर उसमें अगर organic solvent डाल दिया तो that result in the precipitation, okay, due to change in the solvent, like in case of tinctures precipitation. High concentration of electrolyte may cause cracking of emulsion by salting out the emulsifying agent, है ना. अगर कोई emulsion है आपके पास उसमें अगर if you add electrolyte in that emulsion, so that causes the cracking of emulsion. Cracking means what? So it is incompatibility, instability. So it causes cracking of emulsion by salting out the emulsifying agent. So salt and surfactant or salt or emulsifying agent, they are incompatible to each other. Base aluminium chloride and sodium lauryl sulfate, because they are having opposite charge, if they are mixed together it will precipitate. Okay, so suppose there is one emulsion stabilized by sodium lauryl sulfate. Sodium lauryl sulfate की हेल्प से एज अ इमल्सिफाइंग एजेंट आपने एक इमल्शन बनाया तो उसमें अगर बेंज अल्कोनियम क्लोराइड डाल दिया, बेंज अल्कोनियम क्लोराइड will have positive charge and sodium lauryl sulfate will have negative charge, because sodium lauryl sulfate is an anionic surfactant and benzyl alkyl chloride is a cationic. Okay, so that causes the precipitation, that leads to precipitation. So it is a type of immiscibility. Examples of immiscibility, incompatibility. Are you getting or not? समझ रहे हैं आपको? Then second one is a liquefaction. So there is a formation of liquid. If two or more compounds, if they are incompatible with each other, if you try to mix them, you will get a liquid. So there is a liquefaction. For example, due to lowering of melting point upon addition of another substance, they are also known as a eutectic mixture. Also known as a eutectic mixture. इनको ही अपन क्या बोलते हैं? eutectic mixture. Two or more compounds, if they are mixed together, so there is a lowering of their melting point and they become a liquid. And they are known as a eutectic mixture. For example, आपका say camphor. So if you mix a camphor with either menthol, phenol, thymol, or chloral hydrate, you know, if you mix camphor with the menthol, you will get a liquid. If you mix camphor with the phenol or thymol, you will get a liquid. Even if you mix camphor and chloral hydrate, you will get a liquid. Okay, some drugs are also there. For example, your prelocaine, your valproic acid, that is also a that also causes the incompatibility. Okay, so when you mix this ingredient together, it causes the liquefaction. Okay, sodium salicylate, salicylic acid derivative, sodium salicylate, when it is mixed with either one of these, if you mix a सोडियम सैलिसिलेट का अगर मिक्स किया किसके साथ में, इनके साथ में camphor, menthol, phenol, thymol, chlorhydrate, so that result in the liquefaction. Then again Aspirin also get liquefied. Aspirin and phenazone. These two drugs, aspirin जो है आपका and phenazone, if they are mixed together, they will get liquefied. Now, what is the remedy to avoid this? Remedy to avoid the liquefaction. First, you have to triturate one of the drug with adsorbent powder like keolin or light magnesium carbonate. तो अगर आपके पास में एस्पिरिन है और फिनाजोन है, दोनों को आपको बनाना है मिक्सचर, है ना? तो वो बनने जाएंगे आप तो आपको बन जाएगा लिक्विड. तो हाउ यू कैन प्रिवेंट? पहले एस्पिरिन ले लो, उसके उसमें ऐड कर दो क्या, एक तो लाइट केओलिन पाउडर या फिर मैग्नीशियम कार्बोनेट पाउडर या फिर सिंपली टाल्क भी ऐड कर सकते हो. सो यू हैव टू triturate one of the drug with the adsorbent powder like kaolin, light magnesium carbonate or talc, and then you have to add another drug. So you will not get liquefaction. That is the remedy to avoid the liquefaction. Next is nothing but the chemical incompatibility. Chemical incompatibility. It may be due to different chemical reaction and mostly the pH change, okay, or double decomposition or complex formation. Now this chemical incompatibility may be adjusted, may be either adjusted. For example, barbiturates are almost insoluble in the water and their sodium salt they are soluble. Okay? Solutions of salt of barbiturate, solution of salt of barbiturate, they are very alkaline and incompatible with the acids. तो अगर सोडियम barbiturate in a phenobarbital so salt है, if there is a barbiturate, sodium salt of barbiturate, okay, and if you add a flavoring agent like a lemon syrup or ammonium bromide, so that may leads to precipitation of the corresponding barbituric acid. So this is incomparable. Barbituric acid and sodium salt of barbituric acids and this lemon syrup, ammonium chloride, they are incompatible. They are the incompatible. You have to remember. You should remember. They are the incompatible. Now it can be minimized by. It can be minimized by adjusting the pH of the solution. It can be minimized by adjusting the pH of solution. So common ion effect इसमें involve होता है और कुछ नहीं. Adjusted chemical incompatibility. Now there is another one, tolerated. Tolerated. The incompatibilities that can be tolerated in the formulation which does not affect the therapeutic value. Which does not affect the therapeutic value. Example, okay? In precipitation reaction, it may be due to change in the solvent. It is very important for alkaloids. Most of the alkaloids they are insoluble in the water. For example, Nascopine and papaverine, they are extremely insoluble in the water. And that's why a co-solvent citric acid is used for Nascopine to make the solution. They are incompatible with the alkaline media. And if they are present in the very solution becomes alkaline, they will get precipitated. Strychnine hydrochloride, incompatible with the aromatic spirit of ammonia. Aromatic spirit of ammonia, and will get precipitate. Okay, because strychnine क्या है, strychnine hydrochloride क्या है, basic है. Strychnine is a base. बेस है, उसका हाइड्रोक्लोराइड एसिड सॉल्ट है. और अमोनिया क्या है, सो अमोनिया भी बेसिक है. बेसिक उसके बाद में क्या होगा, प्रेसिपिटेशन, इट विल बिकम अनआयनाइज्ड. सो देयर विल बी प्रेसिपिटेशन स्टिचनिंग. सो अनदर इनकम्प्लीट है ना. आपको अभी तो नहीं आता, लेकिन पहले जब व्हेन वी वाज स्टडीइंग द डिप्लोमा ऑफ फार्मेसी 2008 में मेरा डिप्लोमा हो चुका है, उस टाइम पे ये क्वेश्चन आते थे हमको, आइडेंटिफाई द इनकम्पेटेबिलिटी इन द फॉलोइंग प्रिस्क्रिप्शन. तो ऐसा यही क्वेश्चन आते थे, स्टिचनिन हाइड्रोक्लोराइड एंड एरोमेटिक स्पिरिट ऑफ अमोनिया, है ना. डॉक्टर का प्रिस्क्रिप्शन देते थे ना, उसमें देखना है इंग्रेडिएंट कौन सा है, क्या है, और वो आइडेंटिफाई करना है कि कौन सी इनकम्पेटेबिलिटी है. उस टाइप के क्वेश्चन हमको आते थे, अभी आजकल नहीं, लेकिन हमको आते थे. सैलिसिलिक एसिड इज इनकम्पेटेबल विद द लेमन सिरप एंड अदर सिट्रस फ्लेवर. तो अगर उसमें, क्योंकि सैलिसिलिक एसिड क्या है, एसिडिक है, लेमन सिरप भी क्या है, एसिडी है, सिट्रस फ्लेवर भी क्या है, एसिडी. एसिड में डालेंगे तो एसिड का प्रेसिपिटेशन हो जाएगा. फॉर एग्जांपल कार्बन डाइऑक्साइड इवोल्यूशन रिजल्ट इन द प्रिपरेशन ऑफ बोरैक्स, सोडियम बाइकार्बोनेट एंड ग्लिसरीन आर प्रेजेंट इन द फॉर्मुलेशन. अगर किसी फॉर्मुलेशन में बोरैक्स है, सोडियम बाइकार्बोनेट है और ग्लिसरॉल है, तो क्या होता है, वहाँ पे इफरवेसेंट मिक्सचर बन जाता है एंड देयर इज अ रिलीज ऑफ कार्बन डाइऑक्साइड. ओके, सेम इज ट्रू विद द अमोनियम कार्बोनेट, बाइकार्बोनेट एंड स्क्विल सिरप और एसिडिक ड्रग। अगर कोई फॉर्मुलेशन में अमोनियम कार्बोनेट है ना, अमोनियम बाइकार्बोनेट है, अमोनियम कार्बोनेट है, उसके बाद में स्क्विल सिरप है या फिर एसिडिक ड्रग है, तो उसमें भी है मतलब बेस एसिड अगर है तो उसमें कार्बन डाइऑक्साइड रिलीज होगा। बोरेक्स, बोरेक्स मतलब क्या है, बोरिक एसिड होता है, सोडियम बाइकार्बोनेट क्या है, बेस है, बोरिक एसिड क्या है, एसिड है, there is a release of CO2, okay, that may cause discomfort. It is known as a hyperaggressive. Therapeutic incompatibility. Therapeutic incompatibility, they are of different type due to alteration in the therapeutic value of drug by another drug or additive. It may be due to either a pharmacokinetic alteration or pharmacodynamic alteration. So pharmacokinetic alteration के example देखो, कैल्शियम, मैग्नीशियम, आयरन or other metals, you know, they are incompatible with the tetracyclines and fluoroquinones जो एंटीबायोटिक होते हैं, टेट्रासाइक्लिन एंड डीएनए कैटेज इनहिबिटर जो फ्लोरोक्विनोन है, जैसे सिप्रोफ्लोक्सिन, ओफ्लोक्सिन, नॉरफ्लोक्सिन, गेटिफ्लोक्सिन, you know, moxifloxacin, they are the fluoroquinones, so they are incompatible with the metals calcium, magnesium, iron, जितने भी metals, because these metals they binds with this and they will form a chelate, they will form a complex, and these complex they are not, they are having less solubility and they are having less permeability. That's why there is a decrease in the absorption of these drugs. But if you take a, if you take a tetracyclines with the, अगर आपने टेट्रासाइक्लिन का कैप्सूल ले लिया मिल्क के साथ में, तो मिल्क में जो कैल्शियम है वो कैल्शियम क्या करेगा, टेट्रासाइक्लिन के साथ में एक कॉम्प्लेक्स बनाएगा, bond form, and that complex is not absorbed through GIT. So that's why if you take antacids or if you take iron preparation or hematinic preparations, if you take milk, so all these are contraindicated with the tetracycline. अगर tetracycline का ड्रग है आपको, तो इसके साथ में नहीं लेना है कि आयरन प्रिपरेशन, उसके बाद में हेमेटोनिक्स, उसके बाद में एंटासिड्स, उसके बाद में मिल्क प्रिपरेशन, इसके साथ में नहीं लेना है। तो फार्माकोडायनामिक इनकॉम्पेटिबिलिटी, फार्माकोडायनामिक इनकॉम्पेटिबिलिटी, अमाइन कंटेनिंग ड्रग जिसमें भी अमाइन होगा आपको, फॉर एग्जांपल मिल्क होता है, फूड लाइक चीज, बटर, ग्रेप जूस, पनीर, इसमें क्या होता है, इसमें अमाइन होता है, टायरामाइन. So there is one amine known as a tyramine. So tyramine is present in the milk, skimmed milk, then cheese, butter, grape juice, paneer. In case of wine also, so you have tyramine. Okay? Now, which is incompatible with the MAO inhibitors. MAO inhibitors, because tyramine itself is a bioprecursor for dopamine and all this biogenic amines के लिए. Tyramine से भी biogenic amine बनते हैं. Okay? एंड अगर वो बनता है तो माओ इनहिबिटर का यूज नहीं, दे विल डिक्रीज द एफिशिएंसी ऑफ माओ इनहिबिटर्स, एंड दैट इज नोन एज चीज रिएक्शन, वी हैव ऑलरेडी सीन इन द फार्माकोलॉजी, चीज रिएक्शन ऑफ पोसोलॉजी. ओके, सो नेक्स्ट इज द पोसोलॉजी. व्हाट डू यू मीन बाय पोसोलॉजी? इट इज नोन एज द साइंस ऑफ डोज. पोसोलॉजी इज नथिंग बट द साइंस ऑफ डोज. ओके, साइंस ऑफ डोज. सो you have 3 pages: children's, young adult, and then older one. So children's and geriatric patient, they needs a less dose as compared to the young adults. है ना, जो बच्चे हैं, जो बूढ़े हैं, उनको डोज कम लगता है as compared to the young adult. क्यों? क्योंकि बच्चों में, so in the children's they have not developed well their organs as far as liver is concerned, kidney is concerned. So in the children's they have less metabolizing capacity, they have less excretion capacity for the drugs. Okay, in case of geriatric patient, in case of older people, so they have decreased their capacity, where their liver has decreased capacity, their kidney has decreased capacity to excrete. That's why dose adjustment is important for children's and geriatric patient. Now whatever science of dose is nothing but the posology. Posology is the science that deals with the dose of drug. Okay, now if you want to calculate the dose for children, you have different formula. So based upon the adult dose. Okay, so first formula is nothing but the Young's formula. So Young's formula is applicable only if the age of children is less than 12 years. Okay, so if age of children is less than 12 years, then only you can apply this formula. What is the formula? So formula is nothing but the Young's formula is equal to age in a years, age in a years divided by age in a years of child plus 12 into adult dose. Or simply you can say age divided by age plus 12 into adult dose. Suppose they have given you adult dose something, and if they if they are given the adult dose, they will ask you question like this: if the age of children is 10 years and adult dose is 400 milligram, calculate the dose. Okay, calculate the dose of paracetamol liquid for they will ask you question like this: calculate the dose of paracetamol for a child of 10 years age if the adult dose is 500 milligram. Okay, then you have to apply the formula, you have to apply the correct formula depending upon the information given in the question. Okay, so Young's formula is nothing but the age in the child, age in the years divided by age plus 12 divided by age plus 12 into adult dose. Okay, now Clark's formula is the second formula is nothing but the Clark's formula. So this formula is nothing but the calculation of child dose according to the weight of child, कि उसका weight कितना है patient का, child का. So depending on the weight of child, suppose they are given the question like this: calculate the dose of child if the weight of child is this and adult dose is this. तो weight दिया है तो आपको Young's formula अप्लाई करके कुछ नहीं मिलने वाला, गलत आंसर मिलेगा. So you have to apply this Clark's formula. So if weight is given, okay, so what is Clark's formula? Clark's formula is nothing but the weight of child in the pounds. देखो यहाँ पे क्या है, pounds है, pounds. So weight is given in the pounds. Weight of child in the pounds divided by 150 into 100. So weight है ना, यहाँ पे formula क्या होगा, weight divided by 150 into adult dose, 150 into adult dose into adult dose, like this. So Clark's formula, weight of child in the pounds divided by 150 into adult dose. Okay? थर्ड फॉर्मूला होता है फ्राइड्स फॉर्मूला, फ्राइड्स फॉर्मूला, फ्राइड्स फॉर्मूला. सो फॉर कैलकुलेटिंग डोज ऑफ चाइल्ड अप टू 1 ईयर, यहाँ पे देखो जो यंग्स फॉर्मूला था दैट वाज फॉर्मूला फॉर ए चिल्ड्रन मोर देन 1 ईयर एंड अप टू 12 ईयर्स, है ना, 1 से लेके 12 साल तक अगर बच्चे का एज है तो यंग्स फॉर्मूला अप्लाई करना है. अगर उसका वेट दिया है पाउंड में तो क्लार्क्स फॉर्मूला अप्लाई करना है. इफ एज ऑफ चिल्ड्रन इज लेस देन 1 ईयर देन यू हैव टू अप्लाई फ्राइड्स फॉर्मूला. व्हाट इज फ्राइड्स फॉर्मूला? सो एज ऑफ चिल्ड्रन इन द मंथ, मतलब इसको अपन ये भी बोल सकते हैं, अगर मंथ में दिया है तो आपको ये फॉर्मूला अप्लाई करना है. एज ऑफ चिल्ड्रन इन द मंथ डिवाइडेड बाय 150 इनटू अडल्ट डोज. वो जैसे ये ऊपर वाला जो फॉर्मूला है वैसे ही कुछ फॉर्मूला है. डिफरेंस क्या है कि क्लार्क फॉर्मूला में आपको वेट इन पाउंड था और फ्राइड्स फॉर्मूला में क्या है, एज ऑफ चिल्ड्रन इन द मंथ, दैट्स इट. देन नेक्स्ट फॉर्मूला होता है डिलिंग्स फॉर्मूला. डिलिंग्स फॉर्मूला अगेन इट इज अप्लीकेबल फॉर चिल्ड्रन अप टू 20 years. So डिलिंग्स फॉर्मूला इज इक्वल टू एज इन years divided by 20 into adult dose. Age of child in the years divided by 20 into adult dose. Then Mottler's equation is also there, or Mottler's formula is there. It is a formula based upon the calculation of child dose based upon the surface area. Okay. Surface area, square meter surface area formula. It's also known as square meter surface area formula. So Mottler equation is equal to height into weight, height into weight raised to 1 by 2. Height into weight raised to the power 1 by 2 divided by 60. ये फॉर्मूला कैसे आया, क्या आया वो छोड़ो, ठीक है. दैट इज अ Mottler's equation. नाउ नेक्स्ट वन इज अ Crowling's formula. Crowling's formula is nothing but the age in a year plus 1 divided by 24 into adult dose. Crowling's formula. नेक्स्ट होता है आपका Bastard's formula. Bastard's formula. That is nothing but the Bastard's formula is nothing but the age in a years plus 3 divided by 30 into adult dose. तो Crowling's and Bastard's ये थोड़ा सा लाइकवाइज है दिखने में. एंड लास्ट फॉर्मूला है आपका बॉडी सरफेस एरिया फॉर्मूला. तो आपको यहाँ पे क्वेश्चन आता है which formula for child dose calculation is the most accurate? Which formula for child dose calculation is the most accurate? So most accurate formula is nothing but the Okay, calculation based upon the body surface area. This formula is the most accurate because exact dose can be given based upon the surface area of that patient, body surface area of that patient. So body surface area formula क्या है? Body surface area formula is equal to body surface area of child divided by body surface area of adult into adult dose. Body surface area of child divided by body surface area of adult into child dose. So what is the average body surface area of adult? तो अडल्ट का एवरेज बॉडी सरफेस एरिया होता है आपका 1.73 मीटर क्यूब. तो आपको बॉडी सरफेस एरिया चाइल्ड का देंगे और पूछेंगे अडल्ट डोज इतना है. इफ द बॉडी सरफेस एरिया ऑफ चिल्ड्रन इज दिस, अडल्ट डोज इज this, calculate the dose required for the children. So what you do, body surface area of children divided by body surface area of adult, and what is that? It is a 1.73 meter square and adult dose. इसके ऊपर भी एक बार क्वेश्चन आया, what is the body surface area of adult? 1.7, and this is the most accurate formula. क्वेश्चन आ सकता है. These are the formula. इसके अपन ये जो है ना उसके एग्जाम उसके प्रॉब्लम्स अभी नहीं ले रहे, उन देखेंगे. Now Latin terms and abbreviation. Latin terms and abbreviation. So in the older time, Latin terms was there in a dispensing practice. है ना, तो Latin terms कभी कभी क्वेश्चन आता है इसकी, मोस्टली फार्मासिस्ट एग्जाम में क्वेश्चन आता है इसका, ड्रग इंस्पेक्टर में भी आ सकता है और आपको भी आ सकता है. ठीक है, so that's why Latin terms and abbreviations. So what are the Latin terms for dosage form? डोसेज फॉर्म होता है सर, टैबलेट, कैप्सूल, सस्पेंशन, इमल्शन, सपोजिटरी, एरोसोल्स, इंजेक्शंस, सस्पेंशन, सॉल्यूशन, लेंटस, है ना. तो उसके लिए लैटिन टर्म्स कौन सा है? सो यू कैन सी फर्स्ट इज नथिंग बट द ऑरिस्टेली. सो इट इज अ टर्म फॉर ईयर ड्रॉप. इसके ऊपर क्वेश्चन आ चुका है. ऑरिस्टेली इज द टर्म फॉर ईयर ड्रॉप. ऑरिस्टेली इज द लैटिन नाम. इट इज अ लैटिन टर्म, लैटिन नेम. ऑरिस्टेली मीन्स ईयर ड्रॉप. Am I audible to you? Auristally means airdrop and Latin term is auristally, and the meaning of that auristally is nothing but the airdrop. Okay. Then second term is there known as a second term known as a cataplasma. इसके ऊपर भी क्वेश्चन है. So what is meant by cataplasma? Cataplasma means a poultice. So what is meant by poultice? Poultice क्या होता है? So you might have seen one formulation in the medical shop. ना मराठी फॉर्म माहित असेल ते. तुम्हाला जर काही लागलं, तुमचं जर काही तुम्ही जर केलेलं झोल आहे कॉलेजमध्ये, है ना, काही मुलांनी काहीतरी कार्यक्रम केला आहे, कोणाला तरी व्हॉट्सअप मेसेज केलाय आणि मग ते घरी आले आणि त्यांनी मग तुमच्या वडिलांना सांगितलं, मग तुमचे वडील तुम्हाला निवार चोपतात, है ना, आणि चोपल्यानंतर मग तुम्हाला सुचतं, अंग सुचतं, मग तुमची आई येते कोणाला तर सांगते जा बाबा मेडिकल मधून काय घेऊन ये, बजरंग लेप घेऊन ये. बजरंग लेप. तो बजरंग लेप काय असतो? सो बजरंग लेप क्या होता है? That is nothing but the poultice. Bajrang lep is nothing but the poultice. So cataplasma means poultice. Then another term is there, cerulolous. Cerulolous means urethral bogey. Cerulolous मतलब urethral bogey. Cerulolous. Okay? Cerulolous means urethral bogey. Urethral bogey means what? So urethral bogey is nothing but the pencil-like suppositories. Pencil-like suppository. So they are very small in the diameter, but they are larger in the length. Because in the male urethra, male urethra is larger, female urethra is smaller. So in the female urethra, suppositories are used. In the male urethra, urethral bogies are used. Urethral bogies mostly they are used for the आपका अगर यूरेथ्रा में इन्फेक्शन है, यूरेथ्राइटिस, सो इन दैट केस यूरेथ्रल बोगीज आर यूज्ड. सो cereulous means urethral bogies, cataplasma means poultice, auristally means airdrop. Next one is a colunarium. Colunarium मतलब क्या? colunarium मतलब nasal wash. Colunarium means nasal wash. Next one is a colutorium. Colutorium means mouthwash. Colunarium यहाँ पे आप कह सकते हो नारी, NAR, नारी, N for nasal, and colutorium nasal एक हुआ तो माउथ आएगा, ऐसा भी आता है. Then hustus. What do you mean by hustus? इसके ऊपर भी एक और आ चुका है क्वेश्चन. Hustus means a draught. Draught क्या होता है? It is nothing but a solution containing a drug, and that has to that has to be taken once only. For example, आपको अगर बचपन में आपके पेट में अगर worms हो गए, बच्चों के पेट में worms होते हैं बिकॉज वो अगर ज्यादा स्वीट खाते हैं तो उनको worms होते हैं। तो worms अगर हो गए उसके पेट में तो डॉक्टर के पास में जाने के बाद आपको डॉक्टर एक देता है दवाई, है ना, अल्बेंडाजोल सिरप। तो वो अल्बेंडाजोल सिरप जो होता है वो 15 ml का होता है, वो 15 ml का सिरप होता है और वो आपको एक ही टाइम पे लेना है। सो दैट इज अ ड्रॉट इज नथिंग बट द is a solution that has to be taken once only. Next is nothing but the nebula. Nebula means what? Nebula means nasal spray. Nebula is the term for nasal spray solution. Okay. Then oblatum is nothing but the catchet. Catchet क्या होता है? It is a sachet of powder. कुछ आपका पाउडर ड्रग होगा which is a having unpleasant taste है। Now what do you mean by catchet? कैचेट मतलब क्या? A drug powder is enclosed in a vapors prepared from the flour and water। जो भी आपका आटा है, आटा के साथ में जैसे आप चपाती बनाते हो तो आटे का एक वेपर बना हुआ है और वेपर में ही क्या है ड्रग एनक्लोज किया है। तो वो वेपर आपको कैसे लेना है, खाना नहीं है उसको। you have to you have to you have to moisten that vapor with the water। कुछ वाटर में रख के उसको मॉइस्चन करना है और उसको वाटर के साथ में निकल लेना है टू प्रिवेंट द अनवांटेड टेस्ट ऑफ। और नेक्स्ट इज नथिंग बट द पुलविस। व्हाट डू मीन बाय पुलविस इन द लैटिन टर्म्स? पुलविस मींस पाउडर और ए डस्टिंग पाउडर। इसके ऊपर भी क्वेश्चन आता है। यूजेंटम इज नथिंग बट द ऑइंटमेंट। देयर वाज अ क्वेश्चन ऑन दिस आल्सो। Naristili means nasal drop. Naristili means nasal drop. These are the few dosage forms in the Latins. So remember, auristally means eardrop, cataplasma means poultice, cereolus means urethral blockage, colonarium means nasal wash, colutorium means mouthwash, hustus means draught, nebula means spray solution, oblatum means catchet, pulvis means powder or dusting powder. Okay, ugentum means ointment, and then naristali means nasal drop. So these are the few dosage form in Latin terms. इसके ऊपर क्वेश्चन आता है। then for example administration और application related terms। जो ड्रग्स आप लेते हो उसके लिए रिलेटेड टर्म्स कौन से हैं in the Latins? So first is addendus. Okay, first one is addendus. Okay, addendus or addendus, more precisely it is known as addendus। So it is a Latin term, addendus बोलते हैं उसको। addendus means to be added। addendus आप बोलो addendus मतलब to be added। add ऐसा आपको समझ में आएगा। addendus means added। Okay? Then second term is applicandus। applicandus means to be applied, to be applied। deglutindus, deglutindus। Addendus means to be applied, applicandus to be applied, addendus means to be added, deglutendus means to be swallowed। Deglutition is the term for swallowing। So deglutidus means to be swallowed। Then ifricandus means to be rubbed in। Okay, to be rubbed in। Ifricandus means to be rubbed in। Ifricandus। Then sumendus means to be added। sumendus मतलब क्या? to be added। sumendus to be added। then sugendus to be sucked and to be sucked। these are the terms related to administration or application of dosage form। पहले अपन देखे Latin terms for dosage form, सेकंड देखा है administration और application related। तो addendus मतलब to be added, applicandus मतलब to be applied, deglutendus means to be swallowed, ifricandus means to be rubbed, and then sumendus means to be used। sumendus or sumendus। then sugendus means to be sucked। now time of administration के लिए कितने Latin terms हैं? so first is a samel indi। samel indi मतलब क्या? once a day। samel indi means once a day। पहले ये Latin terms। so they used to prescribe the medicine and they used to explain this stir indi। Samil in D, campus in D, like that. So that was the instruction. How many times you have to look that term. Samil in D means once a day. Okay, okay. Twice in D. Okay. Uh, then twice in D means look twice a day. Tear in D. Tear in D मतलब thrice a day. बीस in D मतलब क्या? बीस in D मतलब twice a day. Tear in D मतलब thrice a day. Quarter in D. You know, quarter in D means four times a day. You know, six is in D मतलब six times a day. Quarter in D मतलब four times a day. Six is in D means six times a day. मतलब आपको मेडिसिन कितना टाइम लेना है उसका ये मीनिंग है. Samil in D once a day, bis in D twice a day, tear in D thrice a day, quarter in D four times a day. Now, our time and their correlation. Our time and their correlation, correlated time. मतलब omni हो रहा. First is मतलब time के related कौन से Latin से? Omni हो रहा. Omni हो रहा means every hour. Every hour. Omni हो रहा. Every hours. Alternates horis मतलब every 2 hours. Alternates horis मतलब every 2 hour. Alternates horis every 2 hour. Then antecipos मतलब before meal. इसके ऊपर क्वेश्चन आ चुका है रिसेंटली. एंड पोस्ट सिबोस मतलब आफ्टर मील. सिबोस मतलब मील होता है. मील मतलब आपको मालूम है उसके लिए तो आप जेल में है. Antecipos मतलब before meal, postcipos मतलब after meal. So these are the few terms which are very important for Latin terms. Okay, Latin terms. बाकी और भी बहुत सारे terms होते हैं, but at least these terms they are important. They used to ask these questions. Now balance, types of balance. So as I told you, when there was a dispensing practices, so they were used to unbalance. ना वो balance का capacity के ऊपर भी क्वेश्चन आता है और इवन ये जीपैट में भी आ चुका है. So type of balance, minimum weighable quantity कि उस balance पे ऊपर minimum कितना quantity weigh कर सकते हो. ओके. एंड इंक्रीमेंट वेट मतलब इंक्रीमेंट किससे कितने करना है. मैक्सिमम वेएबल क्वांटिटी कितना है. सो देयर आर थ्री बैलेंसेस. क्लास ए बैलेंस, क्लास बी बैलेंस, क्लास सी बैलेंस. क्लास ए, क्लास बी, क्लास सी. क्लास ए बैलेंस जो है वो देख लेते हैं पहले. क्लास ए बैलेंस, मिनिमम वेएबल क्वांटिटी ऑन ए क्लास ए बैलेंस दैट इज 50 मिलीग्राम. minimum weighing quantity on a class A balance that is a 50 मिलीग्राम. so minimum कम से कम 50 मिलीग्राम आप क्लास A के ऊपर weigh कर सकते हैं. and maximum weighable quantity is nothing but the 1 gram. maximum 1 gram तक आप क्लास A बैलेंस जो है इसके ऊपर weigh कर सकते हो. मान लीजिए आपके पास है ना. तो इंक्रीमेंट कितना करना है मतलब बढ़ाना कितना है 1 मिलीग्राम से बढ़ाना है. Then class B balance minimum weighable quantity is 100 milligram and maximum weighable quantity is 50 milligram, 50 gram, and increment is a 10 milligram. Now class C balance is nothing but the minimum quantity to be weighed is a 1 milligram, 1 gram, and maximum is a 2 kg and increment is 100 milligram. सबसे ज़्यादा okay accurate कौन रहता है class A balance. It is the most accurate. It is the most accurate. Okay, so if you want to measure 100 milligram or if you want to measure a 70 milligram less than 90 milligram or 60 milligram, so you have to use class A balance. If you want to measure more than 100 milligram, you have to weigh on class B balance. You have to weigh more than a gram. है ना, जैसे 5 ग्राम वे करना है, 6 ग्राम 10 ग्राम वे करना है आपको. तो आप अगर क्लास ए के ऊपर बैलेंस के ऊपर वे करोगे तो बैलेंस ही खराब हो जाएगा. अगर आपको 5 ग्राम पाउडर वे करना है, इफ यू वांट टू वे 5 ग्राम पाउडर, इफ यू आर वेइंग ऑन अ क्लास ए बैलेंस, तो बैलेंस विल बी डिस्ट्रॉयड बिकॉज उसका मैक्सिमम कैपेसिटी कितना है 1 ग्राम. वहाँ पे आप 5 ग्राम कैसे वे कर सकते हो, नहीं कर सकते. क्लास बी का वैसा है. क्लास बी मिनिमम 100 mg एंड मैक्सिमम 50 ग्राम. यू कैन टेक अ 10 20 ग्राम 30 ग्राम तक 40 ग्राम तक वे कर सकते हो. बट इफ यू वांट टू है ना, if you want to weigh more than 100 grams, you have to use class C balance. 100 grams से ज़्यादा weight है तो इसके ऊपर weigh करना. It is again very important. Now different dosage forms. different dosage forms. So what are the classification of dosage form? First is the solid dosage form. Am I audible to you? Audible आएगा? Okay. Solid dosage form. In that you are going to have solid मतलब क्या है उसमें powder आता है powder, then tablet, capsule, then gadget, depot preparation, insufflations, tablet triturates, granules, implant, and dentifrices. So solid dosage form. In semi-solid dosage form, you are going to have creams, ointments, suppositories, jellies, paste, gels, etc. etc. These are the semi-solid dosage form. Liquid dosage form, in that you are going to have solutions, syrup, elixirs, linctures, dot, then suspension, emulsion, colidon, then spirit, mixtures, injections, aromatic waters, enema, douches or douches, then lotion, liniment, throat paint, mouthwash and gargle. These are the liquid dosage form. Gases or gaseous dosage form. You know aerosol like gaseous है. Inhalation and spray. That is a gaseous. In miscellaneous dosage form, there is a NDS, novel drug delivery system. We'll see it one by one. Definition भी आपको मालूम होना चाहिए कभी कभी इसके ऊपर एक आधा क्वेश्चन आता है. Common dosage form. So what do you mean by powder? So powder are nothing but the a type of solid dosage form. ये क्या है solid dosage form है. Preparation with the solid preparation containing is solid, loose and dry particles. Powder में क्या होगा? Solid particle होंगे, loose होंगे, dry particles होंगे. Solid, loose, dry particles having a 0.1 to 10 micron size. Now they are swallowed with the water and may be either single dose or multi dose. Maybe single or multi dose. That is a powder. Okay. Then granules. Granules क्या होते हैं? So again solid dosage form. Powdered drug. Powdered drug. They are mixed with either sweetening agent, flavoring agent, coloring agent, and they are made in granules by using granulating agent. That is another granules. Okay. Again, next one is a cachet. Cachet means what? A solid unit dosage form. They are very large to swallow, and they must be immersed in the water. Before swallowing. And okay, drug in the vapor, which is made from a flour and water. जो आपका आटा होता है आटा उसका अपन जैसे वेपर बनाते हैं आटा और आपका जो है आटा एंड वाटर वो वेपर में ड्रग यूज करना है ड्रग तो इमर्स इन द वाटर बिफोर swallowing ड्रग इन वाटर ड्रग इन अ वेपर है ना वेपर मेड फ्रॉम सिंपली आपका वेपर मेड फ्रॉम योर फ्लोर व्हीट फ्लोर और समथिंग उसका ये उससे उसके बीच में हमको ड्रग है and it is not easy to swallow, that's why they are immersed with water and then they are swallowed. Second is nothing but the tablet. So what do you mean by tablet? It is nothing but the solid unit dosage form. Unit है ना एक लेना है दो लेना है तीन लेना है so unit solid dosage form containing a drug with the excipient and it is made by compression or molding. There are different types of tablet and there is a method also, there is also granulation method. Yeah. Types of tablet means simply compressed tablet, coated tablet, film coated tablet, sugar coated tablet, and entry coated tablet. वो आप बाद में देखेंगे. Now next one is a capsule. Next one is a tablet tablet triturate. Yeah, you should know this. What is this? It is again solid dosage form. A potent drug, okay, containing tablet which is made by compression or molding to make a solution that is known as a tablet triturate. Tablet made by molding or compression making a solution known as a tablet triturate. Next होता है capsule मतलब क्या है? Again it is a unit solid dosage form in which drug is enclosed in the empty gelatin capsule which is very much inert in nature है ना that is known as a non-veg capsule. Non-veg मतलब gelatin कहाँ से आता है? Gelatin is obtained from green bones and okay muscles green bones okay so वहाँ से आता है so that is known as a non-veg capsule. Nowadays veg capsules are also available. What is a veg capsule? Veg capsule is nothing but the empty capsule shell made from a cellulose. सेलुलोज से जो कैप्सूल शेप बना है उसको बोलते हैं वेज कैप्सूल, क्योंकि वो सेलुलोज कहाँ से आता है, प्लांट से आता है। और जिलेटिन कहाँ से आता है ना, जैसे आपका स्किन एंड pork एंड बोन्स, उससे आता है जिलेटिन। So that's why. What do you mean by dentrifices? Dentrifices is solid powder, okay, containing medicament for cleansing the teeth. Okay, also contain some mild abrasive agent, उसमें थोड़ा सा डिटर्जेंट भी होगा, and they are used for the dental caries and to reduce the plaque formation in the teeth. उन्हें तो dentrifices। पहले जमाने में एक कोलगेट का पाउडर आता था, एक 10 रुपए का डब्बा आता था जो 3 महीने 4 महीने चलता था, थोड़ा थोड़ा पाउडर लेके घिसना है, dentrifices। नेक्स्ट वन इज नथिंग बट द insufflation. So again it is a dusting powder, medicated dusting powder means dusting powder having drug. It is meant to introduction into body cavities, जैसे आपके nose में, ear में, throat में, vagina में, okay, with the help of apparatus known as an insufflator. These are the testing powder which are meant to introduce into body cavities with the help of insufflator, known as insufflation. Now solution मतलब क्या है? It is a homogeneous mixture of drug with a solvent and comparatively less stable than solid dosage form. Solution मतलब क्या है? ड्रग कंटेनिंग होमोजेनस मिक्सचर है ना, बाकी सॉल्वेंट जो भी होगा, वाटर होगा, एक्विस होगा, या फिर ऑयली होगा, या फिर हाइड्रो अल्कोहलिक होगा, या फिर अल्कोहल होगा, तो जो भी सॉल्वेंट होगा उसमें, तो होमोजेनस मिक्सचर ऑफ ड्रग विद द सॉल्वेंट एंड इट इज लेस स्टेबल देन सॉलिड डोसेज फॉर्म। नेक्स्ट होता है आपका ड्रॉट। ड्रॉट मतलब क्या है? ड्रॉट इज आल्सो नोन एज हस्टस, देखा है। व्हाट इज ड्रॉट? ड्रॉट इज अ monophasic liquid dosage form, oral dosage that is taken as a single dose, which is usually flavored. जैसे एग्जांपल मैंने बोला था आपको, अल्बेंडाजोल टैबलेट, अल्बेंडाजोल सिरप 15 ml का सिरप है, एक ही बार में लेना है। नॉर्मली बाकी सिरप क्या है आपका 2.5 ml लेना है ट्वाइस अ डे, है ना, जैसे 5 ml लेना है ट्वाइस अ डे, ऐसा आपका डोज होता है। बट ड्रॉट जो है दैट इज टेकन वंस ओनली। व्हाट इज सिरप? इज अ थिक विस्कस लिक्विड कंटेनिंग शुगर होता है इसमें 66.67%। इसके ऊपर क्वेश्चन आ चुका है। सिंपल शुगर कंसिस्ट ऑफ सुक्रोज, कितना होता है? 66.67% वेट बाय वॉल्यूम। सिंपल सिरप विल हैव शुगर 66.67% वेट बाय वॉल्यूम एज पर द आईपी में सिंपल सिरप में शुगर कितना होना चाहिए? सिंपल सिरप में सुक्रोज कितना होना चाहिए? 66.67। ड्यू टू हाई ऑस्मोटिक प्रेशर, इसमें क्या है? हाई ऑस्मोटिक प्रेशर होता है, यहाँ पे स्पेलिंग मिस्टेक हो गया है कुछ नहीं। हाई ऑस्मोटिक प्रेशर, सो दे prevent the growth of microorganisms. Due to high osmotic pressure of this sugar, they prevent the growth of microorganisms. इसमें टाइप्स होता है सिंपल सिरप, medicated syrup, flavored syrup, and they are mostly used as a vehicle for other. Now next one is a spirit. आपका जो स्पिरिट है वो अलग है। आपका स्पिरिट मतलब आत्मा, दुखी आत्मा, ये वाला स्पिरिट नहीं है, ये अलग है। सो अल्कोहलिक और हाइड्रोअल्कोहलिक सॉल्यूशंस कंटेनिंग वोलेटाइल सब्सटेंसेस, मोस्टली 50 to 90% इसमें क्या होता है? अल्कोहल ही होता है, दैट्स व्हाई इट इज नोन एज स्पिरिट। मोस्टली यूज्ड एज अ फ्लेवरिंग एजेंट। एरोमेटिक स्पिरिट ऑफ अमोनिया इज आल्सो हैविंग थेरेप्यूटिक वैल्यू। तो कुछ स्पिरिट जो है मोस्टली फ्लेवरिंग एजेंट यूज करते हैं, कुछ स्पिरिट जो होते हैं उसका थेरेप्यूटिक यूज भी होता है। नाउ एरोमेटिक वाटर्स, व्हाट डू यू मीन बाय एरोमेटिक वाटर? दे आर द क्लियर सैचुरेटेड सॉल्यूशन ऑफ aromatic substances, usually volatile oil. They are used again vehicles for oral liquids. लोशन क्या होता है? लोशन आप लगाते हो, है ना, वैसलीन लोशन, सर्दी में आ गया वैसलीन लोशन। तो लिक्विड डोसेज फॉर्म फॉर एक्सटर्नल यूज विदाउट रबिंग और फ्रिक्शन विद द हेल्प ऑफ कॉटन और वूल। तो इसमें विदाउट रबिंग ये अप्लाई करना है, विदाउट कॉटन, विदाउट रबिंग, रब नहीं करना है। रब अगर करेंगे तो उसको बोलेंगे लिंक्टस, सॉरी, रब अगर करेंगे तो उसको बोलेंगे लिनीमेंट। इफ यू आर अप्लाइंग समथिंग बाय रबिंग एक्शन known as a liniment. Next one is a spray. Spray means liquid preparation containing a drug in an aqueous or alcoholic or glycerin containing vehicle meant for application in the nose or throat by means of nebulizer or atomizer. तो स्प्रे मतलब क्या? एटोमाइजर और नेबुलाइजर से आपको स्प्रे करना है आपके नोज में या फिर थ्रोट में, है ना। आप देखो बच्चे को सर्दी हो गई तो वहाँ पे क्या लेके जाते हैं आप? भाप लेने के लिए लेके जाते हो, वो क्या है, एज अ स्प्रे. देन नजल ड्रॉप्स, आई ड्रॉप, एयर ड्रॉप, ये भी है. सो आई ड्रॉप दे आर नथिंग बट द स्टराइल प्रिपरेशन. आई ड्रॉप क्या होते हैं, दे आर द स्टराइल प्रिपरेशन. आई ड्रॉप आर द स्टराइल प्रिपरेशन. Isotonic with the tears and poison free, and they should be instilled into cul-de-sac. Cul-de-sac मतलब आइस का सेक होता है, for the either irrigation purpose or lubrication purpose or diagnostic purpose or treatment. Then airdrop क्या होता है, airdrop they are for the cleansing or you know, cleansing or removing of the wax or treating the infection. A drop containing drug with in water or glycerin or polyethylene glycol or alcohol base. Nasal spray क्या होता है, nasal spray is nasal drop is nothing but the drop containing drug that should be instilled into nostrils. So isotonic, it should be isotonic and neutral, and it should have viscosity similar to your nasal secretion, and it is a drop used in a nasal cavity with the help of drop. So this was the today's session.